Eaton with Information Managers, and we're going to get started with our question and answer period for practice management. So we're going to go through a few questions that we've received and share that information with you. There are resources for you to be able to download when you follow the web page, and you can download the resources that are particular to this particular episode for our question and answers. If you've got any questions during the seminar today, please enter them into the chat box. I'm going to enter a note in here right now so you can see where the chat box pops up on your screen. It's on the right lower corner on my screen, and you can enter your questions in the chat box right there. We are going to start with our PowerPoint slides and go through the questions that have been asked this month for Practice Management Nuggets and our question and answer period. The replay will be available on YouTube live so that you can be able to follow along. And of course, you can go to our website, informationmanagers.ca, and take a look at the question and answer period for that as well. So hold on, we're going to switch the slides over. And I'm going to open up our PowerPoint slides. There we are. All right, so we're going to get started with our question and answer period. If you can see the screen, please let me know that you can see the screen. You can send us a tweet, or you can like us on Facebook and Information Managers, or send us a note in the chat box. And that way I'll be able to see it, and we'll know that everything is working fine for you. All right. So today we're going to talk about a couple of different things. The sponsor for our question and answer period today is the Hiring Employees Resource Packages, and you can take a look at the free PDF ebook download on informationmanagers.ca for hiring templates, and that way you'll be able to find the hiring cycle, our suggestions and recommendations about how you can hire employees and recruit right away, be able to find that next new employee that you need in your organization. And we also have information about orientation, performance appraisals, and even expert interviews with our practice management nugget guests on there as well. So it's not just for hiring employees, it's for being able to maintain the employees, continue their engagement, and to be able to do the performance appraisals, and when the time is right, to be able to do the exit interviews. So take a look at the Hiring Employees Resource Package on informationmanagers.ca. Today we're going to talk about the practice management Q&A, and this is the opportunity where you get to send me questions and we get to discuss them as a group on our practice management Q&A. We'll be able to take your questions through prior to the event starting, so you can send me your questions by email, and we'll answer some additional questions at the chat at the end of our seminar this morning. So depending on how many questions that you have, depends on how long this program is, but we'll probably be wrapped up within 30 minutes. So the questions that we've taken a look at this month have to do with some technology. So one of the questions is, our multidisciplinary team works from multiple sites. Sometimes they have team meetings using Skype or other internet meeting software. What safeguards do you recommend? So we're going to take a look at some technology types of questions, and then we're going to take a look at the privacy activity information. So For those organizations that use multidisciplinary teams, you may be including the patients in that information, or you may not. It might be a multidisciplinary team meeting where you might be talking about a patient or many patients. You need to make sure that you have a clear understanding about what the rules and expectations are about using internet technology, be it Skype or YouTube or GoToMeeting or webinar. We need to acknowledge whether or not the recording is being recorded. This recording or this training session is being recorded, so you know that anything that you offer during this training session will be recorded into our live YouTube stream, and will also be part of and available to our membership sites. So you can send us your questions by chat, or if you want to have a private conversation, you can send us those questions by email. When you start a multidisciplinary team meeting, you need to make sure that you have a clear understanding about what the risks are, and make sure that everybody has that common understanding and that conversation. So you could send a user agreement, a reminder list when you send out the invitation for the meetings, but you could also speak to it during the recording, so it's really obvious that everybody understands that this information is being recorded and will be available in these situations. When you have a multidisciplinary team from different team stakeholders, be clear about who is actually going to be managing the recording. Is it going to be Clinic A or Clinic B, or is the consultant going to manage that recording? And how are people going to have access to that information? So you can share that information right at the beginning at your multidisciplinary team meeting. The other thing to take a look at is who is around the table, and are there going to be other people listening into that conversation in those remote locations? So if you are working from a shared office space, who else is going to have access to hearing the conversation? Using headphones and microphones is one thing that you can use to limit the outside extraneous noise, but somebody is still talking somewhere. So you have to think about the risk about sharing information, whether or not it's visually or by auditorily, or what people can overhear, or might be something what people can see. A lot of people like working from coffee shops, and you might be able to listen into a conversation using a headphone using coffee shops, but who's going to be able to hear your or see your screen, or be able to listen to the person who is speaking? Even though you might not be speaking a lot, maybe you will have the opportunity to speak during a meeting, and being able to observe the screen when you type in the patient's name or that other confidential information. So be aware that those are things that you need to pay attention to on the outside of your organization. Now, if you are listening to this particular recording or participating on the live webinar, you might also have technology that you are using to record the information. So as part of the introductions at the beginning of the meeting, you want to have a conversation about whether or not this information is being recorded, who is recording it, make sure that it's clear that no one else has permission to record it, and who's going to maintain that recording. Will it be kept for 24 hours so that the person that's missing from today's meeting can listen to it? Will it be attached to the patient's record? How is that going to happen? All of those things need to be discussed. You can absolutely have that on paper, but why wouldn't you also want to have that in that multimedia format, so that you can discuss it and have it recorded as part of the recording? That way you know it's really clear that all of the information's in one place. So having the discussion beforehand, having a recap of the information at the top of the meeting. Now, if you're going to have a multidisciplinary type of meeting and you're going to talk about more than one patient, or how are you going to edit that information and make it available just to that one patient file? You might want to have a particular team meeting that only addresses that individual. Obviously, if you're using the cameras or the webcams, having the picture of your face is very identifying. You might have an agreement when you're talking about your multidisciplinary team that you're going to refer to the patient as patient X or patient Y. But when you are also mentioning the healthcare provider names that are attached to that, or the other organizations, or perhaps the family members of the patient, all of that information is potentially identifying. So we tend to get ourselves into a bit of a trap by saying, oh, well, we just won't mention the patient's name and then it won't be identifying. We don't have to worry about it. That may not be the case. So my suggestion is to start off assuming that the discussion is going to be identifying. If you find that there is nothing of significant value that would replace a face-to-face or a whites-of-the-eyes meeting with the patient, there is no significant clinical information that's going to be maintained in this recording, then you can delete the recording. And you might need some help from your IT folks to make sure that the information is securely deleted from all the different redundancies in your internet system. So those are some things that you want to take a look at as far as policies and procedures. You do need to have a written policy and procedure about recording of information, whether or not it's just for business use, for team meetings, and certainly whether or not you include the information for the patient. If you would like some additional resources about sample policies and procedures, do drop us a line. You can send us an email directly or in the chat button, and then we'll be able to follow up with you. You can also ask for that information on Twitter or on Facebook. Send us a direct message, and we'll be able to send you the information by email. So we'll direct message it back to your contact information. So using the information by Skype or other internet means is a way that we want to be able to engage our multidisciplinary team members. If you want to use that same type of technology for our patients, that's an entirely different scope of work that we need to be able to accomplish. We want to make sure that the patients are protected and that they have the appropriate education and skills to understand how that information is going to be used. My suggestion is to have the patient come into a location where they are a participant but not an owner of that technology. So they don't have to worry about managing those records for 10 years. And even though it's the patient's information, it's also the information about the healthcare providers. So just because the conversation is about a particular patient, we still have to address the education and the risks to the patient and the healthcare providers and the organizations about how that information might be managed. So my suggestion would be to have the patient physically come to a location where one of the healthcare providers are, much like telemedicine. So you can still have that telemedicine approach, and then have the healthcare provider provide the technology to be able to support that. You do need the patient's written consent to be able to have that transaction, to be able to certainly to gather the images. They're definitely identifying images for the webcam and the conversations. So you need to use a consent form that's going to capture both the identifying information on the patient, be it visually, by auditorily, and the other information about that healthcare provider. A word about consents at this point. We tend to want to have a very minimum few pieces of paper that patients need to sign. And while that's a good thing, when we try to squeeze too much consents and notices in education on a single piece of paper, the importance of that information gets lost and the usability of that information gets lost. So if you are going to have a consent for a patient to be able to process the information on telemedicine or having some type of an internet-based conversation, I would suggest you want that as a separate consent form. You don't do that a lot most of the time for most organizations. So why have that extra information on a consent form that you are going to use most of the time? Follow the 80-20 rule. If this is something you only do once in a while, have a separate consent form. make it very specific for this particular instance, or perhaps a short series of training, and you still are responsible as the custodian to make sure that the patient has received the appropriate education so that they understand the risks and the benefits. And that's one of the things that I suggest to you, that the patient attends the healthcare provider service, and the healthcare provider actually provides that internet or the telemedia technology. Even if the patient says they use FaceTime all the time and they know how to use it really well, do they know how to appropriately delete it and have it securely deleted after the conversation is completed? So have the patient come to your location. That you can make sure you manage the consent for the patient and the clear understanding with the healthcare providers. You need to remember to address the retention period. So in Alberta, the retention period of patient-related information is generally 10 years, plus the age of majority if the patient is underage at that point in time. And you're going to need to make sure that you understand where that information is being recorded so that you can secure that copy of that information and securely delete it if it's not required for continuing care and treatment. You might have a telemedicine type of a conversation that is not recorded in any way, shape, or form electronically, but you have somebody who is a scribe who is paraphrasing that information, and you record that scripted information, that typed information, or handwritten notes into your patient record, and that's fine as well. So lots of different options. You need to have a policy to help you with that process. You need to have it well documented on paper. You need to have it documented within the recording if you are keeping a recording of that transaction, and then you can manage it as part of your definition of a patient record. So I'm going to pause and see if there are any questions about that conversation before we go in the chat box on your screen. We are going to be able to field those questions. All right, so we don't have any questions coming in at the moment. So we're going to go back to our PowerPoint slides and go to our next question. Okay, privacy. How can we do a privacy activity every month? That's an important question. As a privacy officer, you have a responsibility to make sure that you're providing education on a regular basis. And doing things once a week for Privacy Week or the 15-day Privacy Challenge is a good step, but being able to do things on a regular basis keeps things top of mind. And that way you don't have to do everything all at once. You can take an activity and as a reminder and use that on a regular basis. So one of the things I suggest that you do is have a monthly privacy audit. And in our resources on the download, we have a monthly privacy audit sheet that you can download. And it's really very simple. It's built on the same concept of a health and safety inspection, where a frontline person and one of the supervisors or managers partner and do a walkabout in your working space and see if there are any particular health and safety concerns. You record whether or not there are power cords that are in a place where somebody could trip over them. You record whether or not the fire extinguisher has not been inspected, so it's behind on its annual inspection. Do the same type of thing about privacy activities. Take a look at 3 different types of safeguards. So remember the power of 3. We have administrative, technical, and physical safeguards. And choose 3 things, one from each category, that you want to be able to monitor this month. So perhaps this month you're going to take a look at physical safeguards. Make sure that all of the employees' personal belongings, their cell phones, their purses, their personal keys are locked up and not on the top of a desk where somebody can walk by it and walk away with them. Maybe there'll be a technical safeguard. Every time you walk by an unattended computer, has that person logged out of that computer. Maybe you're going to choose an administrative safeguard. When was the last time that you looked at the oaths of confidentiality for your employees? And are they due to be re-signed and re-educated or to be reviewed? So pick 3 things: an administrative, technical, and physical safeguard. And as you do your walkabout, you can do a written assessment about what you saw. Did you find keys left on the desktop? Did you find purses underneath the desk, or have they been locked away appropriately? And be able to record that. On your monthly activity sheet, you're also going to take a look at what you did last month. So perhaps you did those assessment of those 3 things last month, and you found that everybody left their purses underneath the desk. And you told everybody last month that that's not the best practice. We really want you to encourage you to put it in your desk drawer and to lock your desk drawer when you're not at that location, or whatever your practice is. This month, you're going to take a look and say, how are we doing? We gave the improved performance indicators last month. It's a month later. Is everybody still following those best recommendations? And then you can record that information. So take a look for some new things, refresh the things that you did in the last month, and then that recorded piece of paper, and it only needs to be a page or perhaps 2, becomes something that you share with the staff and the management team. So you might make a copy of it and put it in the lunchroom. You might make it as part of your staff monthly team meetings, and you certainly want to keep it as part of your privacy management program. And your privacy officer, perhaps your education training officer, is going to be recording your privacy management program activities, and doing a monthly audit like this would be one of those activities. So it doesn't have to take a lot of work to be able to do something to promote privacy, confidentiality, and security in your office. This is one practice that I recommend because it is a good way to encourage your frontline staff and your management team to work together on common principles and to be able to fix things that are easily fixed before they become a problem. So you can download that resource right off of the website and make use of that information. So we don't have any other questions this month, so we're going to wrap up. Next month, we're going to do our question and answer on Tuesday, May 12th. So send us your questions by email. You can send us by LinkedIn. We have a private LinkedIn group called Practice Management Nuggets. If you haven't joined us yet, send us an invitation. I'd be happy to have you join us in our practice management group. Of course, you can always chat with us by Twitter, by Facebook, and also directly by picking up the phone. Want to be able to share this information with you. Practice Management Nuggets is our interview series every Thursday, and we have guests talking about experts in their field. And upcoming this week, we have Connie Hampton, who is going to review how to improve your profile for your job search. So she is not the fairy job mother. There are some tips and tools that she's going to have to help us update our resumes and our LinkedIn profiles to be able to get that next job, the next contract, the next presentation or speaking opportunity. Something for everybody on that webinar on April 16th. April 23rd, we're going to be talking about dress code in the work location. And April 30th, Dr. Randy Ross is going to talk with us about relationship marketing and a fantastic way to be able to do community events as a way to promote your healthcare practice. Do join us for these webinars. They're going to be a great value of information, and they're free. So sign up to the webinars and register and share that information. There are lots of ways to stay connected with us. You can join us by email, by LinkedIn, by Twitter, by Facebook, and we now have a podcast series, so you can take us on the go. This is Jean Eaton, your practice management mentor with Information Managers. Thanking you for joining us today and asking you to stay tuned.